Accounts of sudden, widespread respiratory illnesses stretch back centuries, often described as fevers or catarrhs that incapacitated entire communities. Early chroniclers noted outbreaks that moved with alarming speed across regions. In the year 1580, a significant pandemic emerged, beginning perhaps in Asia and rapidly spreading through Africa, Europe, and even reaching the Americas. Contemporary reports detailed coughs, fevers, and aches that laid low vast numbers of people. Throughout the era, such outbreaks were recurrent, though varying in severity. Medical understanding was limited, often attributing the cause to bad air or celestial alignments. During the 18th century, several notable influenza pandemics occurred. One extensive outbreak between 1781 and 1782 traveled across Europe and into Russia, demonstrating the virus's capacity for broad geographical dissemination even before modern transport. As events unfolded into the 19th century, record-keeping improved. The pandemic of 1880-1890, often called the Russian flu, marked a significant moment. It spread with unprecedented rapidity, aided by expanding rail networks and transatlantic travel. Symptoms were widely documented: sudden onset of fever, chills, headache, muscle pain, and profound weakness, followed by respiratory complications. Its global reach and the speed of transmission startled observers. Subsequently, the world experienced a period of relative quiet regarding major pandemics, though seasonal influenza remained a constant. That changed dramatically near the end of the First World War. In the year 1918, an unusually severe and deadly strain of influenza appeared. Initially obscured by wartime censorship, its devastating effects soon became undeniable. Often referred to as the Spanish flu, not because it originated in Spain, but because Spain's neutral status allowed its press to report freely on the epidemic's impact. The virus spread globally in three distinct waves during 1918 and 1919. This particular pandemic was notable for its high mortality rate, especially among healthy young adults aged 20 to 40, a group usually less vulnerable to severe influenza outcomes. Symptoms were often extreme, including rapid onset pneumonia that caused lung damage. Estimates suggest that the 1918 pandemic infected roughly one-third of the world's population at the time. Mortality figures were staggering, with calculations ranging from 20 million to potentially 100 million deaths worldwide. Public health measures such as closing public gathering places and encouraging face coverings were implemented in many cities, with varying degrees of success. Medical personnel were overwhelmed, and the sheer scale of death disrupted societies globally. Personal accounts from the period speak of fear, sudden loss, and communities hollowed out by the illness. The speed with which healthy individuals could succumb was particularly terrifying. Following the 1918 catastrophe, influenza research intensified. Virologists worked to understand the nature of the agent causing the disease. During this period of scientific advancement, the influenza virus itself was eventually isolated in the 1930s. This breakthrough paved the way for developing vaccines. Later pandemics occurred, though none matched the sheer lethality of 1918. In 1957, the Asian flu emerged, caused by a new viral strain. Global health organizations coordinated responses, and a vaccine was developed relatively quickly, mitigating the overall impact compared to 1918. Subsequently, in 1968, the Hong Kong flu pandemic arose. While widespread and causing significant illness and mortality, advancements in medical care and vaccine availability again helped limit the devastation seen decades earlier. Influenza continues to circulate globally, causing seasonal epidemics. Ongoing surveillance tracks viral mutations, informing annual vaccine formulations in an effort to prevent widespread, severe outbreaks. The history of influenza pandemics underscores the enduring challenge posed by infectious diseases. In the year 1976, concerns arose in the United States regarding a potential swine flu outbreak reminiscent of the 1918 strain. A large-scale vaccination program was initiated as a precaution, though the feared pandemic did not ultimately materialize widely. This event, however, highlighted the ongoing vigilance required for pandemic preparedness. Public health systems grappled with the challenge of responding effectively to potential threats. During the late 1990s and early 2000s, attention turned towards avian influenza strains, particularly H5N1. Outbreaks in poultry populations, coupled with sporadic human infections, raised global alarms about the potential for a novel, severe pandemic. Cases of H5N1 in humans, although limited in number, often resulted in severe illness with high mortality rates. International health bodies closely monitored its spread in animal populations and its capacity to adapt for human-to-human transmission. As events unfolded, the next influenza pandemic emerged from a different source. In the spring of 2009, a novel H1N1 influenza virus, containing genetic elements from swine, avian, and human influenza strains, was identified. Originating in North America, this new H1N1 strain spread rapidly across the globe. The World Health Organization declared an influenza pandemic in June 2009. Unlike the 1918 pandemic, the 2009 H1N1 virus disproportionately affected younger people, including children and young adults. However, overall mortality rates were significantly lower than those seen nearly a century earlier. The global response involved increased surveillance, distribution of antiviral medications, and the expedited development and deployment of a specific pandemic vaccine. Prior pandemic planning and international collaboration played crucial roles. Subsequently, the 2009 H1N1 virus transitioned into a regular seasonal influenza strain. Lessons learned from its emergence informed ongoing pandemic preparedness strategies worldwide. Throughout the era following 2009, research continued in understanding influenza virus evolution, transmission dynamics, and the development of more broadly protective or universal vaccines. The potential for novel strains emerging from animal reservoirs remains a constant focus for global health surveillance. The history of influenza pandemics illustrates a recurring pattern: the periodic emergence of novel viral strains capable of widespread transmission, challenging societies and driving advancements in public health and medicine. Each event provides critical knowledge for confronting future outbreaks. Ongoing surveillance systems, established and refined over decades, remain critical. They monitor circulating influenza strains in both human and animal populations, looking for genetic changes that might signal increased pandemic risk. During this period, other avian influenza subtypes continued to cause concern. For instance, the H7N9 virus emerged in China in 2013, causing sporadic but severe human infections, primarily linked to poultry exposure. While H7N9 did not achieve sustained human-to-human transmission needed for a pandemic, its existence underscored the persistent threat posed by viruses circulating in animal reservoirs. The interface between humans and animals, particularly in agricultural settings, is a key focus. Subsequently, efforts intensified to improve the speed of vaccine production. Technologies allowing for faster generation of candidate vaccine viruses and quicker manufacturing scale-up became research priorities. Antiviral medications also remain an important tool, particularly for treatment and potentially for prophylaxis during the early stages of an outbreak before a vaccine is widely available. Resistance monitoring is crucial. As events unfolded globally, the lessons from past influenza pandemics informed preparations for other types of infectious disease outbreaks. The infrastructure for surveillance, laboratory testing, and international communication proved adaptable. The narrative of influenza pandemics is one of constant interaction between human populations and a rapidly evolving virus. Each major event, from the poorly documented outbreaks of centuries past to the scientifically scrutinized pandemics of recent times, adds to our understanding. This long history highlights the unpredictable nature of influenza. New strains can emerge with little warning, necessitating perpetual vigilance and robust global health preparedness. The cyclical pattern of pandemics, interspersed with periods of seasonal activity, demonstrates influenza's enduring capacity to challenge human health systems and societies across the globe. Seasonal influenza itself continues to exert a significant annual toll on global health. Even outside of pandemics, these yearly epidemics cause widespread illness, hospitalizations, and deaths, particularly among the elderly and those with underlying health conditions. During this period of advanced genetic sequencing, scientists gained deeper insights into the mechanisms driving influenza's evolution. Antigenic drift, the gradual accumulation of small genetic changes, necessitates annual updates to seasonal vaccines. Antigenic shift, a more dramatic process involving the swapping of genetic S between different influenza viruses, is the mechanism responsible for creating novel strains with pandemic potential. This often occurs when human, avian, and swine viruses mix, typically within an intermediate host like pigs. Understanding these evolutionary processes is key, yet predicting precisely when or where the next pandemic strain will emerge remains exceptionally difficult. Vigilance involves monitoring countless interactions at the human-animal interface globally. Subsequently, international frameworks like the World Health Organization's Global Influenza Surveillance and Response System, GISRS, became even more vital. This network of laboratories constantly shares virus samples and data, enabling rapid detection and characterization of new threats. Cooperation between nations is fundamental. Sharing surveillance data, research findings, and resources like vaccine technology or antiviral stockpiles strengthens the collective defense against potential pandemics. The economic and social disruption caused by pandemics extends far beyond direct health impacts. Fear, travel restrictions, workforce absenteeism, and strain on healthcare systems can have profound consequences, as historical accounts repeatedly detail. Therefore, pandemic preparedness involves not just medical countermeasures, but also plans for maintaining essential services, communicating effectively with the public, and mitigating economic shocks. The influenza story is intrinsically linked to societal resilience. As events unfold year after year, the influenza virus continues its relentless adaptation. The historical narrative serves as a constant reminder of its potential and the enduring need for scientific research, public health readiness, and global solidarity.